quick update on the turbidity at North Fork right now, or an hour ago or so. It was at 15.3. I was really hoping it would be under 15, but it was windy out there yesterday and especially last night. And today's rain, we think, will ultimately help because it's the right kind of rain. It's slow and straight down. But initially, at least, that could be stirring it up a little more than usual. In-reservoir treatment is happening. They can work in the rain. The Army Corps of Engineers project is moving forward. They can work in the rain too. As far as the Corps of Engineers project, no change to the timeline for that. Late November, early December. And if anything does move that up or back, we will certainly let you know. But right now, we're still on track for late November, early December. A little bit of a subject change today. You know, we've talked about water testing and sampling results before. And as you may recall, Water Resources has been testing for a variety of minerals and bacteria that may impact the quality of our drinking water. Lab staff tested for aluminum, iron, chlorine, manganese, and also for total coliform and E. coli. The results of those tests have been posted on the Water Services Recovery website and updated in real time by our lab staff for a few weeks now. And it is worth noting, our lab staff have run and processed more samples in the last 6 weeks than they would normally run in like 6 months. Those people have really worked as hard as they possibly could to give us the clearest picture possible of the quality of our water. Also included in that sampling plan that's been posted on our website for a couple of weeks now was an investigative sampling program for lead and copper in city and county elementary schools, participating child care facilities, and private schools. Also, out of an abundance of caution, Water Resources also sampled the raw water at North Fork for lead and are awaiting results from a third-party contract lab. Source water at North Fork, Mules River, and Bee Tree, or DeBrule, we call it Bee Tree, but I think most people know it as DeBrule treatment plant. They were last tested for lead at their source water in July. Those results were below the detection limits. And is also worth noting that Water Resources records going back decades do not show detectable levels of lead in the source water at any time. I want to emphasize that. Our records that go back decades do not indicate detectable levels of lead in the source water at any time whatsoever. This investigative lead and copper sampling plan was formulated and implemented under the guidance of both North Carolina DEQ and the federal EPA. The primary purpose of this sampling was to measure the effectiveness of the residual corrosion control treatment. Corrosion control treatment, which is zinc orthophosphate, helps reduce the potential for lead to leach from household plumbing and service line plumbing into drinking water. Due to the piping configuration at North Fork, Water Resources was unable to treat the raw reservoir water in the beginning with zinc orthophosphate, which provides corrosion control, which I already mentioned, provides corrosion control. And we were unable to provide corrosion control for about 19 days. During that period, we were only able to treat the raw water with chlorine. Corrosion control treatment returned when turbidity levels in the North Fork Reservoir lowered enough to begin pushing treated water into the distribution system. That happened 2 weeks ago, yesterday, on October the 30th. So investigative lead and copper samples were collected from 25 points throughout the distribution system between October 17th and October 24th. All the samples were taken from privately owned plumbing. I want to say that again. All the samples were taken from privately owned plumbing. Water Resources received the last of the results from a third-party contract lab on November the 8th. 7 of the schools tested revealed detectable lead levels. all the copper results were well below allowable levels. Schools with detectable levels of lead in the county system are Oakley Elementary School, Sand Hill Elementary School, Charles C. Bell Elementary School, and Glen Arden Elementary School. In the city system, those schools are Lucy Herring Elementary School and Hall Fletcher Elementary School. The private school, the only one who participated, was Odyssey Community School. Upon Water Resources receiving the results from a third-party contract lab, city and county school systems and participating child care facilities were notified. It is very important to note that the students have not consumed the tap water in any of these schools or child care facilities. Schools will keep water fountains closed off and unplugged, and EPA has provided schools guidance that includes the installation of National Sanitation Foundation certified filters that are designed specifically to remove lead or reduce lead. That guidance from the EPA to the schools also includes replacing any plumbing or fixtures that may increase the chances of lead exposure. So essentially, the use of lead in household plumbing was banned in 1988. So any plumbing installed before 88 would, obviously be a little more at risk, at least, of lead exposure. Schools have taken mitigation measures. Students and staff at both systems have not been consuming water. That cannot be said enough. Before school reopened, water fountains were covered. That also cannot be said enough. School nutrition teams continue preparing meals that either do not require water or preparing meals with water that has been purified. Both school systems have initiated these mitigation measures and have notified parents. The school systems continue to follow the guidance from the City of Asheville Water Resources and the EPA. And again, students and staff are not consuming the water. A few messages about lead as a material. Obviously, lead is a serious health hazard for pregnant women, women who are breastfeeding, and children under 6 years old. Until the boil water notice is lifted, it is recommended to use only bottled water or water that has been otherwise treated for making baby formula. That's been posted on the FAQ that's on our website since the very beginning. For information, private residents, for information about testing your service line for lead and to receive a free testing kit, you can contact Water Resources by calling 828-259-5962 or emailing leadprevention@asheville.nc.gov. And it's worth noting now that everything that I have said so far is already posted on our website under the sampling plan. That's been included there for a couple of weeks now. It lives up the top. It's real easy to find. All of this information is posted on the website now, along with the lead and copper sampling results. Water Resources is encouraging residents who are boiling water for consumption. And remember, we've recommended bottled water the whole time, but if there's no way you can get any potable water and you're going to boil it and consuming, we are encouraging residents to run the water from the faucet you're using to gather water for boiling for 30 seconds to 2 minutes, or when you can feel a temperature change in the water. Everybody knows what that's like. When you turn on the cold water faucet, it's a little warmer than it's eventually going to be. So if you are gathering water for boiling from a particular sink, turn on that cold water faucet, put your hand under there, and when it starts to get cold, like the water was obviously underground a few seconds ago, that's when you're good. According to guidance from the EPA, this flushing protocol is a short-term solution that can be used to reduce potential lead and copper presence in drinking water. Depending on the pipe materials, lead and copper may be found in water that has sat undisturbed in household plumbing for 4 to 6 hours. And I'll reiterate, that is especially true for plumbing that was installed prior to 1988. Until more investigative lead and copper sampling is conducted that shows corrosion control treatment has taken effect, please continue to follow this simple flushing protocol daily. Again, run the water from the faucet you're using to gather water for boiling for 30 seconds to 2 minutes, or when you feel that temperature change. According to guidance from the EPA, this is a short-term solution that can be used to reduce potential lead and copper presence in drinking water. And depending on pipe materials, lead and copper may be found in water that has sat undisturbed in household plumbing for 4 to 6 hours. Again, especially true for plumbing installed before 1988. And I realize I just said the same thing exactly twice. That was on purpose. Customers are not receiving water bills right now, so this extra flushing will not cost you anything. In fact, the extra flushing done by customers will help reestablish that corrosion control quicker and help with the overall flushing of the distribution system so we can get off the boil water notice as soon as possible. Potable water is still available for free from the city and the county if residents wish to use it. Water Resources will resample these schools and any participating private residences that had detectable levels of lead at 1 month, 3 months, and 6 months from when corrosion control treatment was reinstated. So that's 1 month, 3 month, and 6 months from October the 30th. Water Resources encourages customers, especially those with homes built prior to 1988, to participate in the city's free lead and copper drinking water testing program. And you can do that by emailing leadprevention@asheville.nc.gov or by calling 828-259-5962. I know you're going to have a lot of questions, and the good news is I have a lot of experts with me here today. We have Brenna Cook, our compliance manager at Water Resources, who heads up our sampling program. We have city and county school superintendents, Dr. Furman and Dr. Jackson. And joining us virtually, we have Brian Smith and Emma Inhorn from the EPA, both of whom have been here. Brian was here at the very beginning, like 3 days after the storm, with Water Resources helping us. And so we're very, very grateful that all of these people have agreed to donate their time and their expertise. But I think, Stacy, can I go ahead and open it up for questions? Are you good with that? All right. I get to open it up for questions today.
Hey, Clay, John Boyle with Asheville Watchdog. I joined a little bit late, so I might have missed some of this, but could you so I know you said the corrosion control was reinstated October 30th. Is that correct?
Correct. Yeah.
Why, can you explain why it took that long to reinstate that and what is involved in that process?
Initially, when we first started pumping raw water into the system, that had all the sediment in it. It was cloudy and murky and all of that. Where we pump that raw water from is in a different location at North Fork than our normal treatment systems, obviously. And the way the piping configuration at North Fork works, we were not able to pump zinc orthophosphate and sodium bicarbonate into that raw water. It's a simple piping configuration issue. It's the way the plant was designed decades ago when it was built. And like I said, we went without that corrosion control treatment for about 19 days.
Okay. And without getting too technical, because I realize it could get really technical, the zinc and sodium bicarbonate, what does that do to provide corrosion protection?
I'm going to call on the first expert, Brenna Cook, our compliance manager. She will have a very good answer for that.
Okay.
And John, you met Brenna
up there
on Monday.
Yeah, right. I remember her.
So for corrosion control treatment, the zinc orthophosphate coats the inside of the pipes, and the zinc basically takes up the lead to inhibit it from reacting and being consumed. And then the bicarbonate is added for alkalinity purposes, so that if the pH should change, it buffers it to keep it from changing and slowing down the corrosion control process.
Okay. And
Corrosion
Brenna,
process, not corrosion control.
Okay, you may know this, or Clay might, but do y'all have any good feel for the percentage of pipes in the system that are vulnerable to the corrosion and releasing lead?
Our distribution pipes do not contain lead. It's mostly service lines that are vulnerable for that, or internal household plumbing.
In any rough estimate on how many households have this older kind of plumbing that's vulnerable?
Probably about, and this is off the top of my head, from our inventory, about 60% of our homes are built before 1988.
And they have that older type of plumbing in them.
We don't know everything about that. Homes could have been remodeled at some point, because these are older homes. They're over 30 years old now. So homes could have been remodeled at some point. It's more up to the homeowner to recognize if they have plumbing that could potentially cause this issue.
Okay, thanks. And then Clay, and like I said, I might have missed this. I apologize if I did, but today's turbidity and this is rainfall, good or bad?
This is, we think, going to end up being the good kind of rainfall because it's slow and it's straight down. It's not blowing sideways. There's not a whole lot of wind associated with it. Now, it was windy out at North Fork yesterday and especially overnight. And so that's probably what kicked that turbidity up from just below 15. I think at one point it was like 14.7. And now, well, at 10 o'clock this morning, it was at 15.3. But if this rainfall stays like this, slow, straight down, it will ultimately help. Yeah.
We have a question in the chat from Scotty from Fox, Carolina. Are you able to say why lead was detected at certain schools? Is it because those schools have older pipes?
That's certainly part of it. And again, I want to stress the schools did absolutely nothing wrong. Nobody did anything wrong. What happened here is when these samples were collected, even though water service had returned, school was not in session. And so the water had sat in these schools' plumbing for like 3 weeks in some cases, 2 to 3 weeks in some cases. And the most sure way to get a detectable level of lead is to test water that has sat in pipes for an extended period of time.
Hey, Clay, it's Laura at BPR.
Morning, Laura.
Morning. I'm confused about the directive, like sort of the end result of all of this for a homeowner. So if you know your pipes are old, I mean, previously we said you flush it once and you're kind of good to go. But now we're saying if you know you have older pipes, you're going to flush every day.
I know I've mentioned that more than a few briefings that intermittent flushing is good for the system, especially when that sediment in the beginning was heavier than it is now. But yeah, if you're going to boil this water for consumption and your plumbing was installed before 1988, it is a really good idea to flush whatever sink you're using to gather this water for boiling for 30 seconds to 2 minutes, or again, until you feel that temperature change. And Brenna has something to add.
So Laura, we've had a lead awareness program for at least 2 or 3 years. And that goes not just for now. When your water has set overnight and you have older plumbing that was installed before 1988, our corrosion control helps reduce the potential for lead exposure. But when water sets that long in your plumbing and you have copper pipe with lead solder or a galvanized iron pipe that could potentially be upstream or downstream of a lead service line, you have the potential, even with the corrosion control, to have a lead get into your water, even with the corrosion control. I want to say that over and over. So I've always recommend whenever I visit a home, if your water has set for 4 to 6 hours, to flush your water for at least 30 seconds to 2 minutes to ensure that you're reducing your potential for lead exposure.
Okay, great. And we're talking really about, I mean, you're saying if you're boiling it to then consume it. So if you're using an alternate water source for consumption, then we're not as concerned about this regular flushing. Is that fair to say?
Correct. Okay. Yeah. Now, generally like if you're going for a long weekend or something like that, or a vacation, it's a good idea to flush your water system for 30 seconds or so when you get back. And that's just standard industry practice. But I don't do it. But it is a good idea, no matter the age of your plumbing or home or whatever.
Question from the chat. Is hot water more vulnerable to inducing the release of lead compared to cold water, or does it make any difference?
So if you visit our lead awareness page, it says specifically it's best not to cook with hot water because one, we don't know what your hot water heater has in it, but hot water is more likely to dissolve lead into your drinking water. So it's just not a good way to use for it. It's best to use cold water for any type of cooking or consumption.
Another one from Brian Queen. When was lead found in the system, and when was the earliest you could have notified the public?
So lead was not found in the system. It was found in private side plumbing, and the facilities that had detectable lead levels were notified within 24 hours, much less than that. I think we got some results back like late one night, and the schools were contacted first thing the next morning.
Is the threat of lead found in the water system at schools over, or is there a certain directive for those schools going forward?
So the directive, obviously, first, nobody's been consuming water at these schools. And the schools have already taken mitigation measures. And if they want to, and the schools are here to answer questions. So if they'll have particular specific things for them, Dr. Jackson and Dr. Furman are happy to answer them about the specific mitigation measures they've taken. But I know there are several already in place. Number one being water fountains haven't been used and water has not been consumed since school returned.
So Clay, is it possible that those problems existed and we just didn't know that because the testing wasn't happening with such frequency that it is now?
That's another Brenna question.
So we are required, all water utilities are required to sample for lead in private homes within the distribution system. We actually just completed doing that July of 2024. So we are not showing any issues. We were not showing any issues within the system before that.
We have some specific timeline questions, Clay. What were the dates of the notification of lead in pipes to the schools and other facilities? And a follow-up to that, the schools were contacted, but are you able to say if parents were notified, even though no one was consuming the water? So dates of notification and notifications out to families.
So the last sample result that we got back, and it was a resample, was on November the 8th, which was Friday of last week. This is my first day presenting this week, so that's been the plan for us. At least I know the schools have notified the parents already. I don't know exactly when that happened, but I want to stress again that nobody at the schools has been consuming the water. And Dr. Mullendord has a very, very brief statement she would like to read.
Hello. I'm Dr. Mullendor, the Medical Director for Buncombe County Health and Human Services. And so while we know that no children or individuals at schools have been consuming the water, it is possible that individual homeowners might have been using water from their taps for drinking or for preparing food. And so I want to address that if that is a reality for you. So we know that there are health risks from lead exposure, and we know that the most vulnerable populations are children under the age of 6, pregnant people, and breastfeeding people. And the reason for that is that children under 6 are growing rapidly, right? So their bodies are growing rapidly. And we know that pregnant people are growing a fetus inside them, which is also growing rapidly. And then breastfeeding people are breastfeeding infants that are growing rapidly. And so if you have a child under the age of 6 who may have been exposed to lead by drinking water or eating food or beverages that were made with the City of Asheville's water, we encourage you to talk with your child's healthcare provider about getting blood lead testing for them. Same if you are a pregnant person or a breastfeeding person who, again, you have potentially been exposed to lead because you have been consuming the city's water or using it for preparing food or beverage. We encourage you to talk with your prenatal care provider or your primary care provider about blood lead testing. Buncombe County Public Health has set up a blood lead information line for healthcare providers and for the public to call if you have questions or concern. That number is 828-250-5205. You will leave a message and a public health nurse will call you back as soon as possible. Again, I just want to reiterate that we don't know, right? There is a lot of variability home to home. So I don't have any we don't have definitive data, but this is just in the interest of caution, right? For our most vulnerable populations. So again, encourage you, children under 6, pregnant people, breastfeeding people, consult with your healthcare provider. If you don't have a healthcare provider, or if you have additional questions, then you can call the Buncombe County blood lead information line. Thank you.
Hey, Clay, I have another question for you. Just briefly scanning this data, Glen Arden Elementary was at a level of 40, which was clearly the highest. And this may be on there, I just missed it, but what is the acceptable parts per billion of lead and why was Glen Arden so high?
So that's a good question. And like everything else with our sampling program, the rules and stuff, there are no like absolutes. Like, and I'm learning this. There are no like yes, no, never, always. It's always malleable and fluid. So for water resources throughout our distribution system, our acceptable level of lead is, yeah. Let's see, I thought I had it right.
So, John, when it comes with NCDQ and EPA regulations for water utilities, not schools, water utilities, when we do our sampling, we'll sample a pool of homes. Right now, we're at reduced monitoring because we've proven that we've not had a lead issue. So we are required to sample at least 50 homes. And once we get all those results back, we have to line the results up in ascending order. And if we beat the 90th percentile and we're below the action level, and right now it's currently 15, but it will soon change to 10, we are meeting all regulations for lead and copper. Our goal, or maximum contaminant level goal, is 0 because, as we know, no amount of lead is good for anyone, especially children under age of 6. But that is our action level, is if we're above 15 parts per billion in our 90th percentile when we do our compliance.
Okay.
As for Glen Arden, I've got the backstory on it. The reason it was so high, that's one of those schools that set for 2 to 3 weeks before we sampled. It had water pretty much the whole time because that's in the Mills River area. And when we sampled the first time and did the first part of the investigative sampling, it was high. But when we went back, if you'll scroll down to the bottom of that spreadsheet where it says the 3T testing, you'll see after we flushed the school and resampled, it was great.
Mm-hmm. Okay.
Yeah, and that sort of reinforces that the flushing protocol works. I think out of all the schools we tested, after the 30-second flush, there was only one that was still above the action limit. Yeah, so 7 initially. After flushing, that number went down to 1.
And thank you, Clay, and don't want to belabor this, but this might be a question for the superintendents if these results at their schools raise concerns with them moving forward? And would they like to do some sort of remediation for the piping at their facilities?
Dr. Jackson is on his way up here, and so is Dr. Furman.
Good morning. I'm Rob Jackson, the superintendent of Buncombe County Schools. I certainly want to start by saying the safety and well-being of our students and staff is always first and paramount. From the very beginning, prior to reopening, we've worked with the water system to ensure that we had safe schools to open. And so we covered our water fountains before our students returned to the schools, and we will keep those covered until testing shows that the water is safe for consumption, however long that takes. To mitigate that, we're delivering bottles of water to all of our county schools and to the charter schools and initially to the city schools, and they're now able to take care of that for the city school system. And we will continue doing that as long as we need to the point that we can test and show and demonstrate that our water is safe for our students for consumption. We'll do that as long as it takes. In terms of mitigation for our schools, we will absolutely pursue the mitigation efforts needed to ensure that our schools are safe for our students and staff members. We'll continue to work to understand what that means, and that will take some time, but we'll do that. We'll take the time it takes because we're going to do everything we can to make sure our students and staff are safe. Thank you for the question. Dr. Furman?
Good afternoon, everyone. So Asheville City Schools, most of our elementary schools have pre-K classrooms. So we actually have lead testing as a regular part of making sure that our water is safe for our pre-K students. So from time to time, we have had detectable levels identified at our schools, and we take mitigation efforts as those come up. But we are pleased that the levels that we saw, especially after flushing, are below that level. And again, our schools are closed, or not closed, but our water fountains are closed. We are not using any of that water at Hall Fletcher or Lucy Herring. And again, as mitigation, as we monitor those levels, we are ready to mitigate as necessary. We have a question for Clay from social media. Do we expect any long-term effect on our pipes from not having that zinc orthophosphate treatment?
That's probably a Brenner question too.
It is not expected, but we can't confidently say that because water chemistry is different and all pipes are different and depending on the age of your home. But as we said, we have reinstated corrosion control and that will reduce the potential for corrosion as time moves forward. Not saying it won't stop it, but it will help reduce the potential for corrosion.
Clay, in terms of the communication around this for people that aren't listening to the briefing, could you just talk us through how you're getting this information out about the need for flushing?
So like I mentioned a minute ago, everything that we've said today is on our website. Obviously, we will do a pretty heavy social media push pretty quick. We will have a press release out this afternoon that links back to all of this. And also the AVL alert will be updated with all of this new information starting today. The AVL alert that I know everybody is tired of getting and probably not a lot of people are listening to. So yeah, we've got a pretty comprehensive plan to roll this out starting immediately after this briefing.
I have one question for Dr. Mullendorf.
Hang on, Laura, you broke up pretty bad there.
Sorry, I said I had a question for Dr. Mullen.
Oh, okay.
Yes.
Hi, just wondering if you have had any reports or increase in reports of the lead issues on the health side.
No, we have not had any reports of that.
Clay, I should have caught Dr. Mullendorf. She was there.
All right, she's coming right back.
Sorry about that.
It's all right. Get my step.
Sorry about that, Dr. Mullendorf. Can you say in general how bad of a problem Buncombe County has with lead? pipes and lead finding in children? Is it a serious concern generally, or is it something that we don't really see much of?
I can't speak to the lead pipes. I mean, and I don't know, I don't have a comparison to say. I mean, yes, we do occasionally get reports of children with elevated lead levels, but that's again not unusual. I wouldn't say it's an exorbitant amount, but it happens, and it happens in every community. But I don't have any numbers or anything for you.
Now, I'm just curious if we're talking, like less than 20 cases a year or
I could get that
100 or
information. I could get that. I think it's on the lower side, but I can get that information for you.
that'd be great. Thank you.